The time for the meeting has arrived. This is the meeting of the Appropriations Special Subcommittee on Department of Human Resources Governance. Today's purpose of today's meeting is to conduct a public hearing. Before we get started, I want to ask the members of the audience, or particularly the ones who have signed up to speak, we're going to have to enforce strictly some ground rules. One is a 5-minute time limit per speaker. The chair is well aware that we're dealing with some matters in which people feel very strongly, and I know it's difficult at times to condense your feelings and input to 5 minutes. But for your information, we have 40 people signed up. That'll carry us to around 5 o'clock as is. And so to help you along with the time, we're going to have this young man hold that up when you have 1 minute left, and then the chair is going to have to ask you to wrap it up at 5 minutes. I hope you understand. We are very interested in what you have to say. That's why we're here, and that's the sole purpose of this meeting, is to take input on this very important bill, House Bill 228. So with that, we will begin. Bill Fields, and another thing, if you don't mind, when you come forward, introduce yourself and let the committee know who you're representing. Bill Fields.
I'm Bill Fields. I represent the Georgia Public Health Association. Thanks for the opportunity to speak on this issue this afternoon. GPHA is an 80-year-old organization whose mission is to advocate for conditions in which all people and communities can be healthy, to promote the scientific foundation of public health practice and policy, and to assure a continuous voice broadly representing public health in Georgia. We have over 1,000 members all over the state. Most are active public health professionals, but we have significant numbers of members from the 9 colleges and universities in the state which grant advanced degrees in public health. You can learn more about us at gapha.org. In 5 minutes, it's impossible for me to comment on all the issues related to House Bill 228. I know from your questions or remarks Monday afternoon that all of you have given the issues represented in this bill a lot of thought and have a good understanding of this matter. Let me begin by saying that GPHA supports passage of this bill. We believe that public health should be removed from DHR as soon as possible. Public health in the counties and districts all over Georgia is on life support. Public health at DHR headquarters at 2 Peachtree is just about flatlined. They are almost dead. Continual reductions in resources, particularly over the last 10 years, and numerous reorganizations have reduced the State Office of Public Health to a condition of almost complete ineffectiveness. There is almost no institutional memory and no sense of common purpose. This is not a reflection on leadership within the division, but rather a result of the organizational environment within DHR. The past 35 years in DHR have not been kind to public health. Public health does not simply need to be moved and or reorganized. Public health in Georgia will have to be reconstructed almost from scratch. I know there's been discussion of how fast to move on the effective date of this bill. I think there are good arguments to be made on both sides of this issue, and there are arguments to be made for making the change this year or next year. However, the words of Mr. Lentz from Monday afternoon's hearing resonate with me. That is, once a decision is made to make this kind of change, delay only makes the change more difficult. I'll follow up on that point with some thoughts on Commissioner Meadows' comments from Monday afternoon. In essence, she said that Georgia could be in for a catastrophe rather than a disaster if public health is weakened to the point at which it could not fulfill its obligations in the area of emergency response. I believe public health has reached this point. Under the Georgia Emergency Operations Plan, that's GEMA's plan, during a declared emergency, Public health is responsible for the entire health care system in Georgia. I ask you to take a look at that plan. It does not qualify health care system in Georgia. Public health would be running health care in Georgia without qualification under the State Emergency Operations Plan. How long should we wait before we begin the work necessary to bring public health to the point where it is up to this task? In closing, there are a lot of detailed issues in this bill, and I urge each of you to seek out staff at your local health department and or district health office to solicit their thoughts on this matter. Again, thanks for the opportunity for GPHA to be here this afternoon.
Thank you, Mr. Fields. Tom Bauer.
Thank you, Mr. Chairman. I'm Tom Bauer with the ARC of Georgia, which is an organization of persons with developmental disabilities, families with persons with developmental disabilities, and their providers. Appreciate the opportunity. I will nowhere come close to my 5 minutes, so I hope I can do my part here. We do appreciate the opportunity. I just wanted to mention a couple of things. While we will always advocate for a separate Department of Developmental Disabilities, we are pleased with the higher profile that this will hopefully give to issues dealing with persons with developmental disabilities, and assume that we will have a division. There are not divisions set out in the bill, and we just sort of want to put that on the table that we would strongly support a division. Also wanted to mention that there is in the bill, as I understand it, sort of a split in the sense that persons with developmental disabilities will be served by two different departments. Those that are in institutions or in the hospitals will be through behavioral health, and of course we're very anxious to see people who can leave institutions and live a full life in the community. So we hope that this bill and the implementation of it will contain a true flow of funds where money follows the person, so that can be a reality. The only other couple of things I'd just like to mention is that we would support the change that you'll hear from the Governor's Council on Developmental Disabilities later toward a functional definition of developmental disability. And the other point we would inquire about is the Babies Can't Wait program. I can't really tell from the bill where that will be, and we hope it will have a high profile and that it will be able to be in a position where funds can be coordinated sufficiently to serve the kids. Thank you.
And thank you, Mr. Bauer. Meg Rogers.
Thank you, Chairman. My name is Meg Rogers, and I am Executive Director of the Cherokee Family Violence Center, which is a battered women's shelter in Cherokee County. We offer services to victims through our emergency shelter and also through our transitional housing program. I'm also currently chair of the Georgia Coalition Against Domestic Violence, which is a coalition of 43 shelters throughout the state of Georgia. And I also currently serve on the Georgia Commission on Family Violence. And it is about the Commission on Family Violence that I wanted to take a few minutes to talk to you about. I understand that this is part of House Bill 228 that would abolish the Commission on Family Violence and integrate certain of their responsibilities into Department of Human Resources. I believe that I am uniquely qualified to talk about my experiences with the Family Violence Unit at the Department of Human Resources and my work on the Commission and working with victims of domestic violence. Contrary to what may have been put forth, I do not believe that there's any overlap in the responsibilities of what the Commission does and what DHR does. DHR strictly, their Family Violence Unit strictly looks at certification issues for shelter and pass-through funding. They're concerned with issues like plastic sheets on the beds, light bulbs, do we have protective covers over our light switches, things like that. and so looks strictly at shelter work. The Commission on Family Violence is uniquely positioned to bring together leaders from all fields. This is prosecutors, judges, medical officials, educators, elder abuse, advocates, and bring us together to look at batterer accountability and victim safety. There is no other agency in the state of Georgia that brings together these particular parties on equal footing to discuss this issue. And my concern would be if this was abolished or in any way diminished by just putting it as an administrative function in DHR, you would really be compromising victim safety and also undermining accountability of batterers. My fear is also just looking at moving, I think, the administrative part of the FFIP certification. My fear of what would happen if we did that it would turn into just an administrative function. And what the Commission does with their FFIP certification and oversight is so much more. It really looks at the value and the integrity of these programs by doing site visits, by checking with advocates in the different communities and prosecutors and probation to see if it actually is safe work. My fear is that it would be more like, did they turn in the paperwork, did they comply with certain things, but it really wouldn't get to offender accountability with these programs. And these are programs that really deal with life and death issues. And so my concern would be it would do to the FFIP certification sort of what has been done to the TPO registry. TPO registry actually was a part of the Commission when it was instituted, and it was done as part of a community, coordinated community response to domestic violence. It's now moved to GBI, where it is really more just an administrative function, and it has not gotten the support. So again, I would like for you to just look at and oppose abolishing the Commission on Family Violence. This commission needs to exist, and it does not need to be a part of this bill. Thank you.
Thank you. Courtney Terwilliger.
I am not Courtney Terwilliger. He's the chairman of the Georgia Association of EMS. He could not be here today. He runs an EMS service in Emmanuel County, and they're dealing with some emergencies. My name is Josh Mackey, but I'm here on his behalf. Georgia EMS represents the EMTs, paramedics, and ambulance services in the state of Georgia. The State Office of EMS and Trauma is the regulatory body over the EMS industry in Georgia, and it's currently located within the Division of Public Health. When this task force was formed last year, the Georgia Association of EMS sent a letter to the task force in support of creating a new Department of Health out of the current Division of Public Health in hopes that it would bring a greater profile to the state office. When the task force issued their recommendations last fall in support of moving the Division of Public Health to DCH, Georgia EMS testified in support of that recommendation. They're currently still supporting that recommendation in hopes that if that were to occur, then there would be one department overseeing the reimbursement and regulation of our profession. And that concludes our comments.
Thank you.
Thanks.
Norma Adams.
Mr. Chair, members of the committee, my name is Norma Adams. I'm the Executive Director of the Georgia Association of Homes and Services for Children. And our association represents over 140 licensed child welfare agencies across the state of Georgia. And these licensed child welfare agencies serve children not only in Department of Human Resources, their Division of Family and Children's Services, their Division of Mental Health, Developmental Disabilities, and Addictive Diseases, but they also serve children that are in the Department of Juvenile Justice and also the Department of Community Health. we are asking your support of an amendment to this bill that makes sense at this time. And what we're asking for is that the Office of Regulatory Services, which regulates and licenses these child welfare agencies, be pulled out of the Department of Human Services and placed with the Office of the Governor, the Office of the Child Advocate, to be an independent and separate office that can function indeed independently to license and regulate all these child serving agencies across all divisions. This makes sense at this time. When DHR was created, these licensed child welfare agencies only serve children under the Department of Human Resources. It made sense that this office be within the Department of Human Resources at that time. But as you know, particularly over the past decade, DHR has been broken up. First, there was the Department of Juvenile Justice that was pulled out. Then there was the Department of Community Health. And now we're proposing that they develop a Department of Behavioral Services, which will serve the children's mental health needs. These child welfare agencies will be serving every one of these agencies. Pulling this department out and putting it with the Office of the Governor, the Office of the Child Advocate, makes sense structurally too, because under the Office of the Governor is several offices that regulate functions that cross departmental lines. A good example of that is the Office of Planning and Budget. They help plan the budgets of all the departments in state government. Another example of that is the newly created Office of Children and Families, which coordinates the functions of all agents, all departments serving children. So what we're proposing, as you can see on your chart here, is that the Office of Regulatory Services be brought underneath the Office of the Governor at this time in this bill. And we ask your support of this amendment to this bill.
Thank you. Clarence Sigler.
Good afternoon. It's an honor to be here before you. My name is Clarence Seeliger. I'm a judge of the Superior Court of DeKalb County. I'm not here so much as a judge, though, but as a member of the Commission on Family Violence. I've been a member since 1996, and for 6 years I was chair of that organization. The Commission was adopted by unanimous vote by the House of Representatives, the House, and of the Senate, and vote of the Governor in 1993, I believe it was. I think Representative Oliver corrected me on it. I thought it might have been 1994. The Commission is unique. It brings together all the various elements that deal with domestic violence. It brings in the prosecuting arm, the Department of Corrections, judges, advocates, all the organizations to deal with violence against children, Janessa, dealing with sexual assault, and they all meet 4 times a year. And they meet at no cost to the state. And people who serve on this commission serve with no salary, and they get no expenses. We show up every 3 months. Out of this organization, we have several different duties. Some of the duties include sponsoring task forces in every county. At one time, the mandate says that we should establish task forces which are similar to the Commission on Family Violence. It is formed by judges and prosecutors and advocates, lawyers, health providers, and that kind of thing in every single judicial circuit. 10 years ago, we had only 5. To my knowledge, the latest figures, we now have 42 judicial circuits, all being coordinated through the Commission on Family Violence, all coordinating their efforts toward ending family violence in Georgia, and in particular their communities. What is being proposed in this case is a termination of the Commission on Family Violence. That the sunset provision, according to House Bill 228, will end on July the 31st. It also transfers a couple of the functions to which I believe the Department of Human Resources or Human Services is woefully unprepared to handle. You've heard about the domestic violence intervention programs. This is a specific program which is basically a criminal justice program. It's designed to deter and hold accountable offenders of people who have violated the rights of women by damaging them. The people who are convicted of domestic violence crimes, simple battery, simple assault, domestic violence battery, are required by law to attend these programs, and judges are required to sentence them to them. They are 24-week programs. They're very tough, and they're designed to provide behavior modification in these batterers. It is not counseling. It is not anger management. It's a lot more, and they're very effective. And any judge who's ever handles domestic violence cases can tell you that. It would not have happened without the intervention of the Commission on Family Violence. There are many other functions besides that. One of the most important things we do is monitor the effectiveness of laws dealing with domestic violence. We have special committees that review them and see how they're doing, whether they're effective or not. If they're not effective, we've been before the legislature and asked them to modify them or change them. We found that they were effective or could be enhanced. We've come before you as well. And many times the legislature has been impressed by what we've had to say. We, in fact, are a resource for the legislature on the issue of domestic violence. We try to do that as best we can. We have a fund of we receive funding of approximately $600,000. I don't know the exact figures. The state only pays $327,000 of that. The rest of it comes from the state, from the federal government, or from grants. I cannot think of any other institution like this in the state of Georgia, and in fact, I think it's unique in the United States of America to have a commission like this, where all these agencies that are dealing with domestic violence have the opportunity to cooperate and work together. It's a marvelous creation, and it should not end. I ask that the Commission on Family Violence sunset provision not be adopted by you, and that the functions of the Commission on Family Violence continue to be where they should be with that commission. Thank you.
Thank you, Judge. Gene Douglas. Gene Douglas. Dr. Catherine Melton. Dr. Catherine Melton. Dr. Julie Pirella.
Good afternoon. My name is Julia Perilla, and I am an associate professor of psychology at Georgia State University. I'm a researcher and a practitioner. I am also a current commission member. I would like to talk to you this morning, and I appreciate the opportunity of being here. I would like to talk to you as a researcher and also as an academician. I also would like to explain for those of you who might not be familiar with the term that we have been using, FVIP, which means Family Violence Intervention Program, which was what Judge Seeliger referred to when he said that judges had to mandate the people into these 24-week programs. But as a researcher, I am very aware that the effectiveness of these FVIPs, the shelter programs that we have in the state, the initiatives to address family violence, all of them, their effectiveness is directly related to the level of coordination among the community players in which they exist. For example, studies throughout the country consistently show that FVIPs are effective only in places in which there is a coordinated community response. They don't work if they're not in that coordinated community response. In our own state, a study conducted by the Commission, which I helped to supervise, regarding the effects of perpetrators attending an FVIP on the safety of his partner, found that survivors' feelings of safety were greatly enhanced when the systems designed to protect them had been working in concert. As a result, the presence of the Commission in Georgia is an important resource for the state's efforts to address violence from both state and local levels. The Georgia Commission on Family Violence has been very successful in bringing together representatives, as the judge mentioned, from every walk of life to address collaboratively the issue of domestic violence at the state level. And this success, the Commission's success for the past 14, 16 plus years, does not go unnoticed at the national level. The Commission, our Commission, is often cited as a model approach for how to intervene at the state level in a concerted manner to provide guidance and support and resources to local communities, which in turn benefit from the expertise and experience of the Commission members and staff. Now, as an academician, I am also aware that one of our tasks is to educate and mentor the next generation of individuals who will take up the work of continuing to address a social problem that unfortunately will not be resolved during our lifetime. The recognition that the Commission has at both the national and local levels attracts outstanding interns from universities in Georgia and other states who want to gain the unique experiences available only at this Commission. These young people not only provide a wonderful human resource to the workings of the Commission, but they are also our hope that in the future the work will continue to be done by individuals who understand domestic violence from within the framework of a true coordinated community response. Thank you.
Thank you. Jessica Noonan.
Good afternoon. My name is Jessica Noonan. I'm the Executive Director of Caminar Latino, which is a community-based intervention program for entire families affected by domestic violence. As director of a community-based organization working with both victims and perpetrators of domestic violence, we know that we cannot lose the Georgia Commission on Family Violence. Eliminating the Commission will not be a savings for Georgia. Currently, the small state allocation for the Commission is leveraged to coordinate thousands of hours of community involvement, which is free. The primary strength of the Commission is that it coordinates the expertise of agencies and individuals working to address family violence in the community, from the local level, from advocates to researchers to judges. It would be cost prohibitive for the state to attempt to replicate this level of expertise. Well, maybe even more important is that the Commission is composed of members from the community, which conveys a message that ending violence against women is a responsibility of the community, not just the government. If this part of 228 is passed, it symbolically and also actually moves the responsibility squarely on the shoulders of the state government, namely DHR. This will not be a cost-saving measure because the more government says that will do for the public, the more public will expect. Leaving the primary responsibility for leading the work of making Georgia safer for women and children where it belongs is in the hands of community experts. They will do a much better job, and it will ultimately cost the state much less. My organization, one of the services that we offer is services for witnesses of domestic violence, children witnesses of domestic violence. It has only been through our work and in collaboration with the Commission have we been able to work with these youth to be future leaders in solving the problems of family violence. The Commission has proven to be a great resource in this work. Through the Commission, they provide the youth with the opportunity to present at the annual conference the studies that they have conducted from their perspective of being witnesses of violence in their homes. Being able to understand the issue of family violence so well is the best prevention strategy so we can have future generations, is the best prevention strategy we can have for future generations in order to break the cycle of family violence. Thank you.
Thank you. Silk Dooley.
Good afternoon, and thank you for the opportunity to speak. So that I don't reiterate some of the profound things that have already been said, I am here as the executive director from Liberty House Battered Women's Shelter in Albany, Georgia, about 4.5 hours from here. Our shelter responds to 17 counties in southwest Georgia, and without the help of the Commission, a lot of the work that we do in 3 circuits would go unnoticed. They have been a resource for us. They have given us the ability to impact on numerous judicial and law enforcement departments and change the thinking of the people that we have to work with in southwest Georgia. We are still fighting the good old boys network without the county commissioners and the Commission on Family Violence helping us and backing us in the work that we do, and putting that under DHR, which is only an administrative arm for us. And because we are already under DHR, let's let the people that know what they're doing do their jobs and not recreate something that is only going to cause us greater hardship and put women and children at risk. Thank you very much.
Thank you, and thank you for coming up here, 4.5 hour drive. Kim Raymond.
Good afternoon. I'm Kim Raymond with the Senior Citizens Advocacy Project, and I'm here today on behalf of the Georgia Gerontology Society, the Georgia Council on Aging, and the area agencies on aging to let you know that we do support House Bill 228, the restructuring of the Department of Human Resources. We do have a co-age priority, and that priority has been co-age's priority. Co-age stands for the Coalition of Advocates for Georgia's Elderly, and our priority is to support the creation of a Department of Aging, and we do have a bill, and we're hoping that you will support that as well. But in terms of this bill, we just have one comment, and it's on page 111 of House Bill 228, Section 22, lines 3894 through 3897. It leaves the Adult Day Center for Aging Adults Licensure Act in the new Department of Human Services instead of moving it with the Office of Regulatory Services to the Department of Health. We believe that that program should remain with ORS, and when funding permits, the regulatory office should continue to create and enforce minimum licensing standards to protect the health, safety, and welfare of those consumers who use adult day services. So that we hope that you will consider making that change in the bill, because we believe because it's a regulatory service, it should go with ORS, and ORS is going to the Department of Health. But we also want you to consider accepting our bill, which is House Bill 354, the creation of a Department of Aging. Thank you so much.
Thank you. Judge James Bass. Judge James Bass. Bill Kurtzy.
Good afternoon, Mr. Chairman, members of the committee. My name is Bill Kirksey. I'm a volunteer for Men Stopping Violence, which is located in Decatur, Georgia. MSV, as we call it, is dedicated to ending men's violence against women. I am here today to express my concerns regarding the elimination of the Georgia Commission on Family Violence and moving the monitoring of the family violence intervention programs to the Department of Human Resources. For 3 generations, domestic violence has had a negative impact on my family. I grew up in a family where domestic violence was present. My children did too. And I have 2 granddaughters that grew up in that environment. So you can clearly see I have ample reason to be very personally committed to ending this violence. My first reaction to the proposed plan to eliminate the commission is, if it ain't broke, don't fix it. Well, I understand, folks, that you've got some tough times and budget cuts need to be made. But eliminating the commission will only save 57% of its budget. The other 43% is from other funding sources. So I encourage you to look at that closely to make sure you're saving the money you think and not losing some money. Secondly, as I volunteer for MSV, a Family Violence Intervention Program, I have a major concern about moving that function to the Department of Human Resources. The programs, as the judge pointed out, are designed to hold abusers and perpetrators accountable. It clearly is a criminal justice function and needs to be a part of the Department of Corrections. My third and my last point, I do not believe that while not all or even most of the functions performed by the Commission will be effectively handled if they are moved to the DHR. I don't want to jump on a bandwagon of bashing DHR, but I do have some concerns about the effectiveness of this department. My daughter is a social worker in Gwinnett County, and she interfaces with DHR, specifically DFACS, on a daily basis. And she observes and tells me constantly that this organization is stressed, it's burdened, and morale is low. So I don't think, therefore I do endorse your goal of reorganizing DHR. I question the timing of moving the key functions of the Commission within that organization. Currently, that Commission is a small, dedicated, and effective staff of 7 people, and their only focus is dedicated to ending family violence. They're a watchdog for the state to prevent this violence, and by having it absorbed into such a much larger organization, which is already burdened, will only remove that while it's undergoing a major organization, would be a mistake. So in summary, I recommend that you keep the monitoring certification of the family violence intervention programs in the Department of Corrections. Secondly, I ask you to closely examine those savings that you hope to obtain. And thirdly, I ask you, reorganize DHR, make it effective and efficient, then reevaluate, and then, only then, evaluate whether it makes sense to move the Commission into that program. I thank you for your time. I do appreciate your challenge that you have concerning these tough economic times.
Thank you. Sergeant Jay Elsner. I hope since he's a sergeant, I hope I pronounced it right.
It's okay. Sometimes I mess it up. Thank you so much for letting me speak. I'm Jay Eisner. I'm a sergeant with DeKalb Police. Been there since 1992. I grew up in DeKalb. And my present job assignment is I'm in charge of our domestic violence detective unit. Me and 6 detectives follow up on the 911 calls that uniform go out on. And I really want to talk about the Commission because I use them every day. They impact how I do my job every day. DeKalb County, unfortunately, has about 30,000 911 calls a year that are domestic violence related. We, as a detective unit, look at about 8,000 cases a year, and I read every single report written. So every morning, I'm looking at these reports. I don't have enough detectives to assign them to every case. So I have to try and figure out, as I look at a case, which one of these could end up a homicide, which one of these could end up really bad. I have to try and figure out where to give detectives to it. In DeKalb, since 92, we've had over 200 domestic violence homicides, over 200 women, children, men murdered. We take our job real seriously because we know that our decisions can save lives. So, talk about the Commission. They're the ones who instituted fatality review, where we looked at murders, figured out what are the things that tip us to it, how can we do it differently. So, just a few weeks ago, I saw a couple of things in a report that made me think, okay, this one needs a detective because of what I knew from fatality review. My detective made contact with the mother of the victim because of the training she got at the state commission training they do every year that the commission puts on. She was able to get the person who was initially resistant to open up to us. We figured out that the children were actually being held hostage, as was the victim. We hit the door of the SWAT team, saved the kids, saved the mother, and even took him without a shot being fired, even though he was waiting for us because of the intel we'd gathered. We saved 4 lives that night, 5 really if you count his. And that was because of what we know from working with the Commission. My unit, we wouldn't even exist without the Commission, the leadership, because the Commission is almost like the steering committee. They're the ones who make sure that we keep adapting every year to make sure what we do gets better. The task forces that they organize, That's where everybody involved in that county that works on this issue, that's what brings us together to make sure we're working off the same page. I've been in government since '92, and the thing I see is that we mostly in each organization don't work together. The commission, it's like, what, 7 employees, $300,000 a year? They're the ones who across the whole state bring all the different elements together. So we actually are working together smartly, working to save lives. I really, and I don't normally come down here, I'm a street cop, but I just cannot tell you how strongly I feel about the need for the commission to be there. My unit, okay, we've worked to develop a lot of information, a lot of knowledge to do our job well. You couldn't just replace those 7 detectives and have us do our job. All that information, there's no way to write it down for the people who come after us. Same with the commission. The knowledge that is there, the people who have worked so long together, there's no way to just part that out to other organizations, have it continue. I just want to finish with those people, that small unit, leverage so much good across the state in terms of how we respond and how we save lives that I really don't even want to think about what it could look like next year if we don't have fatality review. We don't have the training conference. We don't have the task forces in each community making everybody work together. So I really appreciate, again, y'all letting me speak. And thank you so much.
Thank you. Judge Nancy Bills. Hi. Sit here, or you can. I think the mic's on up there if you don't mind standing there.
Yes, ma'am. I am here as the chair of our task force in Rockdale County, and I'm also the state court judge there. And I just wanted to address the committee about terminating the commission against family violence. And I wanted to let the committee know how important the commission has been to our task force, and that I think it's the most efficient use of money that the state could use. The reasons are twofold. The creation of the commission and their monitoring of local task forces enables local task forces to go out into their own communities and create the coordinated response to domestic violence. And we have been able to make a huge difference in our community, and of course the task forces are all volunteers. So the money that is spent on the commission is the best way to stretch the dollar, because they then advise local task forces, and then we go out and make the changes in our community. That saves money on law enforcement, it saves lives. So I would strongly, strongly urge that House Bill 228, that provision be changed and that the commission be re-upped for another 4 years. The other important thing that they do is they monitor the family violence intervention programs. And as you all know, the law requires that the court sentence people to the family violence intervention programs. So their monitoring of those programs ensures that they are of the quality that they need to be, and they also make sure that they are involved within the local task forces. So the people that we sentence to go to the FVIPs, those providers are involved in our task force with us. So we know them, we have personal relationships with them. So we know that the people that we're sending to them are getting the quality training and behavioral management that they need to get. So I think it is vitally important that the commission stay in place. And I think that is the best use of the state's money that could be used. Do any of you have any questions?
Any questions? I don't think so. Thank you so much for coming,
Thank
Judge.
you.
Eric Jacobson.
Actually, I'm going to have Tom Seigler speak for me. Good afternoon, Mr. Chairman and members of the committee. I'm Tom Seigler, Chairperson of the Governor's Council on Developmental Disabilities. Over the last few months, the members of the Council have had many opportunities to discuss the proposed reorganization. To assist us in these discussions, we conducted a survey that we're sharing here with you today. First, let me say that the overwhelming majority of almost 600 people who responded to the survey and the Council supports the efforts of the Governor and this Commission to reorganize the Department of Human Resources to be more efficient and effective. The opportunity to restructure the Department of Human Resources presents the state with enormous opportunity that should be capitalized on in a thoughtful, strategic manner. The Council has been asked many times by legislators, providers, agency heads, and the Governor's Office what we think should happen with the Office of Developmental Disabilities and with Babies Can't Wait. We very much appreciate that our opinion has been sought on the issues, and for both these programs there are many concerns and the structural solution is not readily clear. While the majority of respondents would like for there to be a separate Department of Developmental Disabilities, it is recognized that whether developmental disabilities is placed in the Department of Human Services or Behavioral Health, developmental disabilities must be at a division level with a competent director reporting directly to the Commissioner. We recommend a separate division of developmental disabilities with its name, structure, financing, and programmatic responsibilities specifically laid out in the legislation. With the creation of a division of developmental disabilities, we must make sure that the money attached to developmental disabilities remains in developmental disabilities, whether that money is for community-based services or money that supports those still in state hospitals. Separating the money from mental health, addictive disease, and developmental disability will be a challenge despite forensic accounting. But we're particularly concerned that developmental disability funds do not continue to be blurred between division lines. Give developmental disabilities a strong fiscal accounting mechanism, legislative oversight, a lockbox, firewall, whatever, but please give us this where we will be able to project the needs of the waiting list and begin to make substantial progress on stabilizing it at a reasonable rate. Without this accountability, we fear that either in the Department of Human Services or in Behavioral Health, our funding is too easily transferred to plug holes unrelated to developmental disability. The Council has identified several other issues within the legislation that we believe need to be addressed. First, throughout House Bill 228, there are inconsistent definitions for developmental disabilities, some of which are outdated and clearly offensive. All references to mental retardation should be removed and replaced with developmental disability. For instance, in Section 2-29, developmental disability is defined as a state of significantly sub-average general intellectual functioning existing concurrently with deficits in adaptive behavior and originating in the developmental period. This is a direct restating of the American Association of Mental Retardation, now called Intellectual Disabilities, definition of mental retardation. The Council recommends that the definition of a developmental disability be consistent with the Federal Developmental Disabilities Bill of Rights and Assistance Act and Medicaid law, which recognizes that developmental disability is any mental or physical impairment that happens before the age of 22, is expected to last the lifetime of an individual, and impacts 3 areas of daily living, including self-care, expressive language, learning, mobility, self-direction, or the capacity for independent living and economic self-sufficiency. It also recognizes that infants and children may be difficult to diagnose. It says that when applied to infants and young children, birth to age 5, it means those children who have substantial developmental delay or specific congenital or acquired conditions with a high probability of resulting in developmental disability if services are not provided. We believe this is a more moral definition and better reflects the individuals who are served by the developmental disability system. Secondly, while there is currently a regional system in place, this legislation muddles considerably the authority and responsibility of the regional offices and hospitals in behavioral health section of the bill. Serious thought needs to be given to the delivery of services on the regional level. If the Office of Developmental Disabilities is to be split out from mental health and addictive disease, there are still issues that are not clear. Third, in Section 2-23, the Governor's Office has recommended that the Governor's Council on Developmental Disabilities remove the term governor from its title, and we have no problem with this recommendation. We also suggest adding a statement that the Council shall submit annual reports of its recommendations and evaluation of their implementation concerning the developmental disability system to the Governor and the General Assembly. Finally, our survey revealed that overwhelmingly most people believe that Babies Can't Wait should be in the Department of Early Care and Learning. For the past several years, the program has experienced many changes that have significantly impacted its ability to complete its mission. The window of opportunity to correct developmental issues is small, and the limitations that have been imposed on this program have narrowed the opportunities even further. If not corrected or addressed early, these children's issues become the responsibility and expense of the school system. And I believe time has expired. I believe we left you copies of the rest of what I was going to say. Thank you.
Thank you so much. And I think I sort of skipped over somebody. Natalie Fielder. Thank you.
Hi, my name is Natalie Fielder. I'm the program coordinator for Family Intervention Specialists, 501c3 nonprofit organization. We are a core mental health provider in Paulding County. I am also a member of the task force, the Domestic Violence Task Force in Paulding County, and I am here in support of the Georgia Commission on Family Violence because of how much they have helped us in our efforts to fight family violence in our community. We have used their trainings. We have used many materials that they have presented so that we can bring them to our local community and educate DFAGs, educate the people involved in our court system, various lay members in the community, in order to help out our victims. We have sat in the courtrooms and watched an extension of a TPO hearing being turned into a bond hearing to release that batterer, which does nothing but totally re-victimize that victim. And we have come a long way, do not get me wrong, but there's so much more work to be done, and the Commission helps us every step of the way. We are really concerned that if staff is cut, if the tasks that they do are moved into DHS, that we are really not going to have the help that we need in our communities, for our task forces, for our mental health agencies, for the shelters, for everyone involved in helping out these victims. So I just hope that we can consider keeping the Commission intact for the entire state of Georgia.
Thank you. Josh Norris.
Thank you, Chair and members of the committee. My name is Josh Norris. I'm the Director of Legal Advocacy at the Georgia Advocacy Office. We are the statewide protection advocacy system for people with disabilities throughout the state of Georgia. We are a private nonprofit, but we are federally funded. We operate under fairly significant mandates to investigate and advocate in situations of abuse, neglect, death of people with disabilities. So we spend a whole lot of time in state hospitals, and we are very, very interested in the process that's taking place here. And in thinking about this, in light of various agreements that have been agreed to recently with the Department of Justice, the Department of Health and Human Services, around the institutionalized people in this state, we think a lot about keeping promises and integrity. And I think the state has made a series of promises, rather substantial promises, not only in those agreements, but also in accepting federal funding and a variety of other things. And what we want to make sure we do is we keep sight of those promises and the integrity of what we are actually trying to do here. We believe that we blow it, honestly. We, as an organization, and others who serve people, anybody who's in human services, we blow it when we lose sight of those promises, when we actually lose sight of the needs of people. Why are we doing this? We're doing this to meet the needs of people. And if we are not keeping that front and center, we're going to get off the path. While we agree that there needs to be an overhaul substantially, we want to make sure we go back as we do this and engage in this process to those needs and promises. Because if from our perspective, what happens is when bureaucracies and systems lose sight of those needs, lose sight of those promises, you end up with irrelevant things happening, incoherent things happening, and worst case scenario, harmful things happening. I can tell you today that despite what's going on with DOJ and the Department of Health and Human Services, we still have people being abused and neglected in our state hospitals. We still have people dying. Okay? And these are despite best efforts of a lot of good folks within the state system to have a different outcome. But we still have people being harmed, awful things being happening to folks. Excuse me. So I want to keep that front and center as we move forward, because a lot of those folks are going to be impacted by what we do with this legislation. One of the things that one of the previous speakers touched on was the fact that you've got, as it relates to the state hospitals, under the current piece of legislation, you'd have them in the Department of Behavioral Health. Well, that actually would be the Department of Mental Health, really, and you'd have folks with developmental disabilities in ICFMRs, intermediate care facilities that are operated on the state hospital campuses under essentially a mental health authority. Fundamentally, this is incoherent. Okay? One of the problems that we've run into, I think, and other people know about this relative to funding issues, is that we've mixed the money. No one can tell you where the money's gone. We've funded services, we've funded things, but we don't know if those dollars went to DD services or whether they went to mental health services. Now, one of the fundamental things about this is that DD services in the state hospitals get Medicaid match. Okay, they are ICFMRs, they are licensed and certified under Medicaid. They get federal dollars. You get that roughly 2-to-1 match. State psych units do not. Those are state dollars. Okay, and I think one of the things that causes great concern is there's been a lack of clarity about a lot of that. And I am not convinced at all that we are going to address those issues if we still have that all joined under one department. I think what people with developmental disabilities and psychiatric disabilities deserve are some clear leadership and vision about the kinds of systems and supports that we want, particularly community-based services and systems, that we have accountability, and that we have some transparency around who's making the decisions, the programs and services to be provided, how we're going to fund those things. And I think as currently constituted under this bill, there's a whole lack of clarity around that. Okay? I think one of the other issues as it relates to the Department of Health is the fact that, and I picked up on this, it's interesting how people conceive of things, but on page 12 of line 409, it actually talks about, it talks about the Department of Health dealing with both mental health and physical health issues, but there's a strike through on mental health. Okay, let's be clear. The Department of Health, as the Medicaid agency, will have a role in mental health services in this state. There are a variety of strategies relative to Medicaid where you can fund community-based services for people with mental illness. And I would submit that we have not taken full advantage of those. And oftentimes it seems as though the Department of Human Resources is largely the agency left to sort that out. One final thing I would leave us with is the fact that Mr. Tanner from the governor's office the other day when he was testifying talked about structure. You look at other states, there are a variety of different structures. Sometimes it's a consolidated thing, sometimes it's spread out amongst a variety of departments and divisions. The nugget in that, and what he didn't really get to or articulate, was the fact that, quite honestly, structure, it kind of matters, but not really. What really matters is leadership, clarity of vision, and the appropriate resources to get the job done. Okay? We know how to do this, and so in all the hoopla around reorganizing, I want to, again, take us back to what are we trying to do? What promises have we made? Are we actually meeting the needs of people? I submit we are not, and we need to take a real close look at what we are doing or not doing to meet those needs. Thank you.
Thank you. Sir, could you come back? We have a question for you.
Yes.
What, you said that you're a federally funded not-for-profit.
Yes, sir.
And what is the mission of your organization?
It is to protect and advocate. We're called P&As. Every state has one. But we're called P&As. It's protect and advocate people with disabilities. And our highest priority is to protect people and advocate on behalf of folks in instances where there's been abuse or neglect.
Do you actually deliver services to individuals?
We deliver advocacy services, which can comprise legal services as well. But we are not a service provider in the sense of providing other supports or health care services, that kind of thing. No.
I guess since you're a federally funded not-for-profit, whose responsibility is this? Is it the federal governments, is it the state governments, or is it the local governments, in your opinion?
Responsibility for what?
To take care of these people that we're talking about.
Well, I think it's actually it's all of us, quite frankly. But I think that as we go about crafting systems and legislation, if the state is taking on, which it has traditionally, that responsibility, then I think we need to do it responsibly with the people's needs in mind and in line with best practices.
Thank you.
Thank you so much.
Thank you.
How do you pronounce that name?
Good afternoon. Thank you. Drove up from Macon, so I appreciate the opportunity to speak to you today. I'd like to talk in support of this bill.
Sir, could you move the mic down a little bit? Thank you.
Okay, sorry.
We couldn't hear you.
My name is Tony Blash. I'm from Macon, Georgia, and I want to talk in support of this bill. Since the inception of DHR in 1970 under Governor Jimmy Carter, the Department of Human Resources has become many things to many people. And sometimes it's hard to meet the demands of a constituency that expects a lot from you. It's my hope that during this reorganization process that the new Department of Human Services strive even more to reach those constituents who reside not just in Atlanta, rural Georgia, or in the southernmost parts of our state, but they go where the needs are, because in some areas there are needs that are greater and much more large than in other cases. So I ask that during this time of great financial challenge to our state's economy, that there be a careful and equal balance of resource given to the programs in which DHS will oversee. All these services are great services. None of them need to be cut. This bill was about reorganization, not about eliminating or cutting services. So there are no small needs or large needs. They're just needs. So please make sure that you continue to reach the people of this state in every corner of our state, because we're connected by a common thread. We all want a healthy and prosperous Georgia, and that won't be possible without all of us working together. Accountability goes without saying, so we must make sure that it's an important piece of the puzzle. So I do support this bill as a foster parent, adopted parent who have two special needs children who partake of these services. So I ask you to fully fund this bill and fully fund all of the services that have been represented here today, because they're truly needful services. There's a purpose for every service that's being represented here. And I think it's the legislature's responsibility to fund these services. They were created for a reason. So I ask you to support this bill not only with your vote, but also with the resources that are needed to support these services. Thank you.
Thank you. Thank you. Now we'd like former Representative Ann Mueller. Ann.
Could I ask you to go ahead and
Yes.
Got some facts that I don't have that might make my speech shorter.
Okay, well that's fine. June.
Come stand over here so you won't forget.
There's no way we'd forget you, Ann.
I hope you're right.
And I had the opposite thought that I would go after the expert, and then you were.
Greetings and thank y'all for the opportunity. And I really thought that the spokesman, Dr. Glenn Thomas for Community Service Boards, would come and be ahead of us. I'm speaking more as a parent today. I could have worn all my hats. I'm a parent, I'm a provider, and a strong advocate. And I'll end up telling my age. I'm probably one of the few people in the room that's still working that started when DHR started in 1972. So do your math and you can figure it out. And I went around our communities asking people to come help join us to begin services for people with developmental disabilities. And I often said, you or I could have a child. 2 years later, I did have my first precious daughter, Gina, who has developmental disabilities. So I see firsthand where training, therapy, treatment, medical services, all the things can work and do work. Through all the years and as a provider of services for people with mental illness, developmental disabilities, and addictive diseases, we've made great strides. But the department has become so large that I feel now it's time that we branch out. We support House Bill 228. We, however, would like to see all three disabilities come out together, and like for once for everybody from top to bottom to be on the same page and have the professionals with disabilities working, and you're not distracted by all the other things that now that are great important needs too in DHR, but I'd like to see all the disabilities come out together. So that's what I'm proposing that to you to make the amendment and the change to House Bill 228. We have survived certainly all these years, and we're this much older, and Gina's now 34. And her question to the governor when she first met him when he was elected, that was a question she came up with all by herself: are you going to make it a sunny day for the disabled? So that's the question we always ask. Are you going to make? We remind the governor of his promise to Gina, and every day, they had their picture made together, and it's on our refrigerator, so I see it every day, looking for the sun to come out for people with disabilities. And there's no greater need. So I hope that we find the money. I hope that we look at the way to divide it up, to bring us out, to give us our day so that it's going to be sunny. Also, I speak today because there are other needs besides just our that come into restructuring. And I believe Representative Houston, you asked about that the other day, about our hospitals, about our funding. I do hope that we come out so our services are not dismantled. We need all the services from our outpatient services and our services in the community. I'm all for community services, but we also need some deep-in acute hospital bed services. And that, I'm afraid, is with the mental health game plan, is being changed, and we do need to keep those services. For funding and cuts, I say, we know the economy's bad, but look for things that we can cut that are non-direct and keep our direct services so that we can indeed make it a truly sunny day for people with disabilities. And thank you for allowing me to speak as a parent, a provider, and a strong advocate. And if you have any questions, I'll be happy to entertain those.
Thank you. Do we have any questions? Yeah. What number is it?
What you do, and certainly appreciate Miss Mueller, who I served with for a long time.
A dear friend of mine, isn't she a champion? Yeah.
Absolutely. I'd ask you the same question that I asked before. Who do you think this responsibility is? Is it to take care of these people? Is it the federal government's responsibility? Is it the states, or do you believe it's the local government's responsibility?
It's all of ours. It's us coming together as stakeholders, and each of us has a role. And I do believe we are our brother's keepers, and I do believe that we have that challenge. And we do receive both state and federal funding. And when we started in the early days, I told you about, our county commissioners had to put in a a fourth of the money to even start our program. So we don't ever need to leave out the local communities.
Right. I appreciate your statement about Brothers Keepers, and that's us as human beings.
Right. Yes, sir.
We're talking about the government here and how to...
And as taxpayers, yes, sir.
Right. And how do we most efficiently deliver these services as well? And I guess my question is, if it's the state's responsibility, why is the federal government putting money there? I certainly agree with the local communities being involved. I mean, that they're closer to the public. Right. But I again, my concern with the delivery of services is the bureaucracy that's been created, and somewhat, if you will, the business of providing the service is separate from the individual that the service is supposed to be provided to. And
there are some positive aspects.
Oh, absolutely. I'd appreciate any input you have with the multiple hats that you wear with regard to how we most efficiently deliver those services.
For example, the Medicaid waiver program.
Right.
We were able to put up just the state match to then be able to bill Medicaid and get additional federal dollars. So therein comes the federal piece. But then anytime we know as a state that we take federal monies, then more regulations and everything come. So there would be the fine balance of, and our budgets in DHR, funded by the state, but we do have a lot of participating federal monies also. Yes, sir. And I will be happy to, answer any other questions or supply you with additional information so that together all of the entities can do. And I feel like we will be best served coming out into our new department and with developmental disabilities being a distinct division within that department. Thank you very much.
Thank you.
Ann was next, but can we break the team up because this doctor's got to go back to Grady?
Yeah, okay. Dr. Cheryl Heron.
We haven't forgotten you. But
Are we moving the doctor around? She is an ER physician at Grady, and she's got to get back. So.
Thank you, Mr. Chairman. You weren't supposed to say that out loud. I try to keep my emergency medicine stuff in case somebody needs me, but in case somebody needs me, I'm here. My name is Cheryl Heron. I'm an emergency medicine physician. I'm a member of the Georgia College of Emergency Physicians. I sit on the board of the Women's Resource Center to End Domestic Violence, and I'm a proud member of the Georgia Commission on Family Violence. And I'm here today to oppose or voice my concern for the elimination of the Georgia Commission on Family Violence from House Bill 228. And in trying to think about what to say, I think the best way to start is just to read you something that I actually read at the commission meeting several years ago. I've actually published it on how family violence had impacted me personally and why I believe the value of the Georgia Commission on Family Violence has to be sustained. So please indulge me for just a moment, because I think speaking from the words of the patients I care for will give voice to the need for this commission to continue. And so it reads, 3:59, patient pronounced dead, not yet 4 hours into October, Domestic Violence Awareness Month. Agony and tears, this has got to cease, desist and end, but how? We need to address homeland security at home. I knew it would be critical, the EMS captain said. It's bad. How would we know, how could we know? 4 people were involved. A domestic, a 48 at the scene, a 12-year-old snuffed out without the chance to be a man in this land we say is filled with opportunity. Updated on the call, a traumatic arrest, vital signs lost in the field of an 82-year-old man with multiple stab wounds to the chest. He arrived at 3:58 and was pronounced by me at 3:59. 3:59, not yet 4 hours into October, Domestic Violence Awareness Month. The grandmother arrives next, a 78-year-old woman stabbed with multiple wounds to the back and her chest. It is hard to breathe, yet we do our best. But her pressure keeps dropping and she needs a tube in her chest. To the OR she goes with her condition critical. She arrives next, a 33-year-old woman. She's unaware of the murder of her child and her grandfather. She, too, was stabbed with wounds to her back. She was trying to prevent a senseless attack of a man gone crazed who wanted sex. He grabbed a knife with blood everywhere. In my heart, I fear, telling her of the murders. Her injuries are stable. She's wheeled to another room with a chaplain, a social worker, and doctors, including me, and we must tell her. So we sit and we listen, and she tells of the violence. Stop, she begs him. Please don't hurt anyone, she says, but it's too late. And we have to tell her of the murders of her son and her grandfather. We have to tell her, and so we begin slowly, yet deliberately. She awaits good news, and we have none to give her. Her 12-year-old had too many wounds, too much blood lost. He died at the scene. What do you mean? Please take me instead. I've killed my son, but sadly we're not done. She asks, what of my grandparents? I must see them to apologize. They let him stay in their home, and it wasn't wise. It's not good, we tell her. Grandfather stabbed multiple times. What we said next, I silently prayed. Too much blood lost, of life no sign. He was dead, murdered, and pronounced by me at 3:59. Stemming the flow of blood, trying to put a finger in the hole of lives lost from domestic violence. A blip on the map, a reality still avoided. There is no homeland security at home. It's all our mission to protect and to support, to learn and to believe that we need homeland security at home. 3:59, not yet 4 hours into October, which is Domestic Violence Awareness Month. So why did I bring this to you this afternoon? 1 week ago today, I had to testify in court about what I saw that day when the family came into my emergency department. And it is because of the work of the Georgia Commission on Family Violence that I've been able to give voice to the medical community about the need for us to work in partnership with all constituents about this issue and this crime called family violence. We're in an economic crisis, I understand, and I do believe and know that with more people out of work, that the violence will increase. I do believe as we have returning veterans coming back from a war, that the violence will increase. And I certainly believe that without the Commission and without the work of the members of the Commission and without the citizens of the state, our work will only be more. A penny wise but pound foolish, I believe we must really think about how we do and what we do to stem the tide of family violence in Georgia. I thank you for attention. I thank you for your time, and I wish you good luck in your efforts.
Thank you very much. Our next speaker is a former distinguished member of the Georgia House of Representatives for a long time from Savannah, Representative Ann Mueller.
Thank you very much. I've got some paper here. I know y'all dying to have some, but I'm going to give you some anyway. It'll help the landfill if nothing else.
Representative Mueller, you haven't changed a bit.
Well, I try to be realistic. You know, I hope that's enough. If not, I got some more. I'm here today to talk to you about House Bill 228. I believe that it's the restructuring of DHR is long overdue. It is such a mammoth department. Possibly when it was all put together back in Carter's day, it might have been a good idea. Well, we didn't have as many people back then. We didn't have as many problems, apparently. And probably it was a good thing. But right now, it needs to be dismantled. There is no one person in the world, in my opinion, that it's smart enough to take care of all this unless they just never sleep, never eat, or never do anything else. It's mammoth, and it certainly needs to be dismantled. One of my main concerns, though, is the Department of MHADDD. I hate initials, but I'm going to use them: mental health, developmental disabilities, and addictive diseases. I believe it needs to be broken out, but I think the three need to stay together. Some people have said no, but I say yes. So y'all just read this and do what I say, and we'll be okay. But we won't have to go on any further. You can just take it to the floor of the House, pass it, and move along. But I'm afraid that's not going to happen. But anyway, You do have people with dual and in some cases triple diagnosis. Why should they be split out? It's going to be difficult enough to treat them with 2 or 3 problems without having to send them to this department and that department and some other department. I think it needs to be kept together. Right now, mental health is the main thing I wrote about in this because we are having problems with our hospital being closed. Now, they'll tell you it's not being closed, but I say it is. And I'm right. But right now we have forensic beds, which are going to be moved to Milledgeville. We have long-term care, which is going to be put in the community, which I'm not sure is a very good idea. Some, yes, some need to be in the community. They don't need to be institutionalized. But I have a story that I won't bother you with, but that person needed to be in an institution there forever. He tried to kill his mother. And it was a very sad. The police got there just as he ran a knife through the door. She called me at 3 in the morning, 2:30 in the morning, somewhere along there. And I said, well, what can I do to help you? She said, just talk to me while I'm dying. If you think I went back to sleep after that, you're crazy. It scared me to death. But the police got there just before he broke the door down and got to her. Someone like that needs long-term care. They do not need to be in the community as I see it. Our acute care beds have been dumbed down from 35 to 16 or 19, I can't remember which. And they're going to take those eventually and turn them into crisis units. Well, we need all of those. We need a crisis unit. We need acute care. We need long-term care. We don't need and we need people in the community. But you can't get rid of a hospital. Yeah, they're going to tell you the hospital's there, the building is there. But a building with no services, to me, is just a building. It's not doing anybody any good, no matter what you say. So I'm asking that you keep our hospitals open. I talked to my sheriff a couple of weeks ago, and at that particular time, he had 313 patients in his jail with mental health problems. He said, I don't want them here. They need treatment. I can't give them treatment, but I have to take them because the police pick them up and bring them here. I talked to the county commission chairman. It cost over $15,500+ a day to keep those plus 300 people there. Is that good use of your money? No. Wouldn't it be better to have it in community programs or long-term care or something of that sort? I think so. I talked to the police chief. He said, my officers have to go out, take these people into the jail. They don't need to go to jail, but we have no other place to put them. That takes my officers off the street when they should be taking care of victims or potential victims of crime. So to me, I think we need to do something right now. We don't need to wait longer. We need to go ahead and divide up this department, and I think we need to put DD in with AD and MH because, as I said, you do have dual diagnosis many times. I think that to put it in 1 minute, just put that thing down. I'm not through, okay? I see you, though. I'll try to be good. And if I don't, I'll probably get the hook around the neck, so it's no problem. But I think that, and I mentioned this in the last page of this thing. Y'all got this yesterday if you read it. If you didn't, you need to. But the other departments will have training, residential care. They'll have medical services, employment services, and so forth in the MHAD department. Why not put DD in there, too? I have a fellow that lives with me. I'm his guardian. He's 62. He's mentally retarded. I know y'all don't like that term, but that's what he is, and he's just as precious as if he was okay. He is okay, to tell you the truth. He's a lot smarter than I am about a lot of things. But his parents died, and he has to come live with me, so he's living with me. He never needs to be in an institution. He needs residential care. When I die, where is he going if he doesn't have residential treatment? His family, he has a family, but they're not in real good shape themselves. They're not quite as old as me, but they act like they're older. They don't come to see him. They don't take care of him. I can't believe that they're going to take him when I die. I want Robert to have some place to go where he'll be cared for and taken care of and loved. Thank y'all for letting me take up all your time, including that plus minute. But I thank you very much. Read this and do what I say. That's all I got to say. Thank you very much.
Reverend Mueller, if you think I was going to stop you, you were wrong. You can talk long you want.
Nicky, you're still a wonderful fellow.
Well, thank you for your long and distinguished service in the Georgia House. Nora Hayes.
I can't believe I have to follow that. My name is Nora Haynes, and I'm president of the National Alliance on Mental Illness, NAMI. I am a NAMI mommy. I have a son, Miss Mueller, who has been in jail 12 times, and he's been in a state hospital many times and a private hospital many times. And I could just say the same thing she said and just look at what I give you and just do it. But I don't think I would have as much power as she. But on one side are just my suggestions where I went through the bill, the particular part on the Department of Behavioral Health. And then on the other side of your sheet, I wanted to remind you that Governor Perdue did execute 3 executive orders. One is what we're dealing with pretty much now, and the other that I wanted to read part of it to you is from the Mental Health Commission report. And I'm not going to read you the whole thing because I know y'all can read. Although not directly in its mandated purview, the Commission wishes to endorse the creation of a fully funded and cabinet-level Department of Behavioral Services to bring attention, focus, and innovation to the mental health and addictive diseases program provided by or through the public sector with its community, public, and private partners. And then down at the bottom part, I wanted to reiterate to you, Georgia's public mental health system deserves and should receive the same fiscal and legislative consideration as any other basic state infrastructure priorities such as education, public safety, and public health. If not, individuals with mental illness will continue to have a devastating impact on the state's basic infrastructure. I think it's very important that mental health comes out and is in its own department. Tomorrow at noon, we're having a rally on the steps, Washington Street side, Have a Heart, Save a Mind, and I hope you all will be there. Any questions? Are you going to ask me the same question you asked the others? Well, I conferred with my attorney, Stan Jones. And I am not an attorney, but he is. And it just seems to me that in the state constitution, I believe it does say it's the state's responsibility to take care of people that have serious mental illness. Is that right, my attorney? He is not paying attention. Thank you for your time, and I appreciate what you do. Thank you.
Thank you. Dr. Glenn Thomas.
Chairman Chanel and members of the subcommittee. My name is Glenn Thomas, and I'm the Executive Director of Satilla Community Service Board, headquartered in Waycross, which serves 8 rural southeast Georgia counties. I'm here today representing the Georgia Association of Community Service Boards. And actually, my good friend and neighbour, June DiPolito, has pretty much said all of the things that I'm going to say, but I'll quickly run through if you don't mind. CSBs were created by the General Assembly as public corporations and instrumentalities of the state of Georgia. They're public providers of mental health, developmental disabilities and addictive disease services. The Georgia Association of Community Service Boards is comprised of all 26 CSBs in Georgia. The association supports passage of House Bill 228. We believe that a Department of Behavioral Health will permit Georgia once again to focus more intently and more efficiently on the needs of adults with severe and persistent mental illness, children and adolescents with emotional disturbance, and people of all ages who are battling addiction to alcohol and other drugs. Community service boards serve over half of the consumers or clients in DHR contracted community services for individuals with developmental disability. This represents over 6,000 individuals in the state of Georgia. 38% of these individuals also have a co-occurring mental illness. For these, and for other reasons, the Association would prefer locating the developmental disabilities programs in the new Department of Behavioral Health rather than housing them in the Department of Human Services. Recent reports by the Atlanta Journal-Constitution of deaths in state psychiatric hospitals and countless editorials and articles in newspapers all over the state deploring some aspect of the state's mental health services underscore the need for Georgia to move mental health, developmental disabilities and addictive diseases higher among the state's priorities. A similar set of news articles on conditions in Central State Hospital in Milledgeville in the late 1950s led to 2 decades of expansion of services that resulted in a system of 10 hospitals and a network of 26 community service boards. The mental health game plan currently proposed by DHR could be a major step backwards. This regressive plan would put on hold until the behavioral health. This regressive plan should be put on hold until the behavioral health department is in place, and its commissioner can work cooperatively with consumers, family advocates, and providers to fashion the best plan for the state of Georgia. This afternoon we've heard quite a few voices suggesting that there should be changes to House Bill 228, and the Commission Against Family Violence is one of those changes that I'm sure is very desirable. There is another change over which we have some concern, and the main one is the one of delaying the effective date of the legislation. Why would delaying the implementation of the restructuring of DHR be problematic? I can offer a few reasons. One, the same issues will confront us later as are confronting us now, so nothing will change. We cannot afford not to do it now in the long run, because we will then save money by reorganising sooner, and delivery of services will be more focused and more efficient. Another year under the current setup allows for a continuation of the difficulties that prompted the desire to restructure in any case, and could set up potential problems. And as has been said earlier this afternoon, I think delay makes necessary change more difficult. Thank you for your time. You have a background paper with some details of some language changes to the bill which the Association would like to recommend.
Thank you. Sarah Schwartz.
Good afternoon. My name is Sarah Schwartz, and I'm the Executive Director of Mental Health America of Georgia. I'm here today speaking on behalf of my organization and also Ellen Yeager, who is our Director of Public Policy and Advocacy. Unfortunately, she couldn't be here today. Thank you, Chairman Chanel and the committee, for allowing me the opportunity to speak to you today about the reorganization of DHR. In Georgia, 1 in 4 people are affected by a mental health diagnosis each year. This 25% of the population includes children, adults, and the elderly. Many of these individuals' diagnoses co-occur with substance abuse. Unfortunately, in our state, more people with mental health, addictive disease, or co-occurring disorders are treated in jail than in community services or our psychiatric hospitals. And all the need for mental health and addictive disease services in Georgia is clear. To this end, Mental Health America of Georgia supports the concept behind House Bill 228. To best serve Georgia citizens with mental illness and addictive disease, we believe that creating a new department for MH&AD, as well as appointing a new board and commissioner and having a coordinating council, is a step in the right direction. It will be good to house the planning and service delivery of MH&AD in the same agency because of the frequency with which co-occurring disorders happen. Further, this action will bring a more concentrated focus to mental health and addictive diseases, increase exposure and accountability regarding outcomes and funding streams, allow for better outcome data, and provide a direct line to the executive level of the state. We're pleased to see this progress. However, we have some questions and some reservations. We don't want to see the creation of the department held up. However, we have concerns which, if they're not dealt with now, we believe could cause serious problems in the future. First, the concept of regional planning boards is right on target. The problem, though, is that it doesn't work as it's currently set up. Having only 5 regions makes each region too large, and true community input is thus impossible. Second, there does not appear to be any specific structure in place for how the new department's commissioner and board will be selected. Also, if the board has to be confirmed by the Senate, it could take 6 months before this can happen due to the timing of the session. So will there be a transitional board created in the interim? Finally, it will be crucial for the leadership of the new department to have expertise in mental health and addictive disease. Third, we recommend additional members be added to the Behavioral Health Coordinating Council, and that these members be consumers of mental health and addictive disease services and their families. Fourth, to create better coordination and outcomes, we recommend that prevention and early intervention services be part of the new department. For example, suicide prevention activities should be integrated into mental health services. Finally, we have great concern about the funding resources to create and support the work of this new department. Thank you very much for your time and attention.
If you would hold on 1 second, Representative Gardner has a question.
You mentioned the planning councils, the regional planning boards. To what extent are they still useful? I mean, they seemed like a good idea 5 years ago, but I understand they're not functioning anymore.
The concept behind them is right on target in terms of getting community input for the planning. However, you're right. Now they are essentially, they're pretty much not useful now because the areas are way too large, and so they're no longer community. You know, one part of one region is very different from another.
So would your recommendation be to eliminate them?
Well, to increase the regions, I would think, but I don't really have a recommendation on that right now, but definitely to have an increased number of planning boards seems to be the logical thing to do, just so that there is actual community involvement and participation.
Thank you.
Thank you.
Thank you.
Neil Carl-Neckett.
Good afternoon. My name is Neil Kaltenecker. I'm the Executive Director of the Georgia Council on Substance Abuse. It's a pleasure to be here this afternoon. I'm going to echo a lot of the statements that Sarah just did around the recommendations of Mental Health America. And first of all, the Georgia Council on Substance Abuse supports the development of the Department of Behavioral Health. We think that this allows for not only an increased visibility of addiction prevention and treatment, but also a concentrated focus. And we also know that there's a tremendous crossover rate between people with a serious and persistent mental illness as well as people with substance use disorders and substance dependence. We also think it provides an opportunity for strong leadership. Not that that opportunity doesn't exist now, but I think that opportunity hasn't been taken advantage of necessarily lately with addiction services in the past. And it tends to get buried in a bureaucracy, mainly due to the fact that we're under-resourced relative to the other disabilities as well. So although we support this legislation, support the new Department of Behavioral Health, we also have some concerns around the structure, and the legislation is a little bit confusing in some areas. And I've outlined those on the handout you have in front of you. First of all, the Behavioral Health Coordinating Council. It currently reads to include a family member of a consumer of public behavioral health services appointed by the governor, a parent of a child receiving public behavioral health services appointed by the governor. This, to me, is a little short-sighted. If the Department of Behavioral Health is, in fact, going to have both disabilities, mental health and addiction or addictive diseases, we think there should be a representative from each. That it's not necessarily, I don't want to use the word fair, but it's not representative. If you only have a mental health consumer or a parent of a mental health consumer, we think it should be both, and not either or. There are no advocates listed on the council. I know that sounds self-serving, because the Georgia Council on Substance Abuse serves in an advocacy role. I don't care if it's me. Just an advocate that has maybe some statewide purview or statewideness that they can actually speak to issues around substance abuse prevention and treatment for consumers, for providers, for families, and for agencies as well. As far as the regional structure goes, we have a concern about how that's going to actually work in the new agency. Regions have gotten larger and larger over the last several years as a response to budget cuts, and the staffs at the regions have gotten smaller and smaller. Not saying that big government is the answer necessarily, but there has to be some accountability. And if we believe that the problems are going to be solved in communities, I think we have to have community input. And you lose that with these huge regions and these huge regional boards. And then there's not a whole lot of accountability in terms of contracting and quality assurance and process improvement and quality improvement of providers as you go down the road if you don't have someone watching over. And if that's done from a centralized if it's done from the Department of Behavioral Health, I think you lose something. You lose that community input. So it's a little confusing of how you may not have a program specialist for each disability now in the region office. And so if DD is taken out of there, who does that work at the regional level? It's a little bit confusing. We also have some concerns, and it could be that I just haven't caught it in the legislation, but prevention services, as you well know, the Substance Abuse Prevention and Treatment Block Grant has a 20% mandatory set-aside for prevention services. In the current configuration with DHR, substance abuse prevention and treatment has been put under the Division of Public Health. Hopefully that'll be brought back under the Department of Behavioral Health, under the Office of Addictive Diseases. We know that if we integrate prevention, early intervention, and treatment, you're going to get more bang for your buck. So we'd like to see that brought back under, with that, along with that 20% set aside. And just a final word about, I know this isn't an appropriations meeting, but just about funding. The governor's budget currently recommends a 13% cut to adult addictive diseases and an astonishing 38% cut to children and adolescent services for addictive diseases. We think that this not only puts the federal maintenance of effort requirement in danger over the next couple of years, it also is going to start the new Department of Behavioral Health Office of Addictive Diseases with seriously diminished resources, and we think that's not a good thing going in. Actually, I'd like to thank you again for being here. Before I'm asked whose responsibility it is, this is what I have to say about that. If you're talking about financial responsibility, I think that it is the responsibility of state and federal governments to be good stewards of the money and to make sure that the money is spent the way it's intended to be spent. However, I think none of us will disagree. I mean, if you talk about behavioral health, it really is, there is some personal responsibility involved, but there's also community responsibility involved. And I think one of the things we've gotten away from with this regional system that you were talking about before, Representative Gardner, is that they have gotten so big, so communities don't necessarily have the ability or the structure within to network, because not all of these services have a cost attached to them in terms of, you know, a unit of service for 15 minutes of sitting in front of a counselor. Some of them, you know, the churches, local faith-based organizations want to help. Sometimes with a regional structure, the way it is, they don't have a mechanism to do that. So I'd like to say thank you. We support this legislation. If there's anything you need from me, my numbers and contact information is on that sheet. Thank you.
And Representative Scott has a question.
I want to. I appreciate you answering that question. The reason I asked
before it was asked,
but the reason I asked that is because if the federal government, the state government, and the local governments are all pursuing this thing in a manner that consumes more money without delivering as many services as possible, then we're not being fair to either the taxpayers or the person with the developmental disability. And it somewhat amazes me that our country's made it as far as we have without identifying what the federal government's responsibilities are, the state governments and the local governments, and not just with regard to this issue, but with regard to a lot of issues. Mm-hmm. And I'm sure the gentleman does a good job, but I question why the federal government is providing funds to private not-for-profits when if they're not actually delivering a service directly to the patient. I mean, could those funds be better spent elsewhere?
Sure. I think you could always find efficiencies in spending money. I think we have to beware of the trap we fall into as a country in looking for simple solutions to complex problems. I think addiction is a chronic health condition, and I think it has many aspects. I think so does mental health. I think so does developmental disabilities as well. So, you know, it really doesn't have an easy answer. I think it's an interesting question, and I appreciate you saying that, but I think there's responsibility lies on many, many levels. If we know, however, I think we have a responsibility, if we know certain things about a disability, if we know that we can keep a child from taking a drink before the age of 21, he or she is 4 times less likely to become an alcoholic and have a substance use disorder. If we know that, what is our responsibility to that child and that family to support that? I mean, I think it's a great question.
Thank you.
If I had another hour, I'd love to talk about that.
Thank you.
Okay, thank you.
Margie Bush.
Good afternoon. I appreciate the opportunity to speak to all of you. My name is Margie Bush. I'm the president and CEO of St. Jude's Recovery Center. We're a 501c3 not-for-profit organization. We're the largest provider of addiction treatment services and dual diagnosis services, probably in the state. We're licensed by the state and accredited nationally. I also want to speak to you representing 280 private providers. We have an association of community-based providers, and today there are 280 of us. Back in 1993, there weren't many of us, but I'll go over that later. I'm also a family member who has lost 2 family members, 2 loved ones, to the disease of addiction, and also because of a lack of community services for those people that I loved. We serve over 1,000 men, women, and children at St. Jude's every year with a full continuum of care, all the way from detox, residential, outpatient, family services, and now we have permanent supportive housing. In 1993, we were able to expand our services, due in part to the change taking place in Georgia to develop community services and increase the number and variety of providers across the state. And for some of us that have been around a while, that was House Bill 100. The vision of consumers, families, advocates, and providers was to develop a system so that we could serve a person close to their home and a rapid response to crisis, that we had quality options in treatment, dedication to full and sustainable recovery for our consumers, and a commitment that every person deserves to be treated with dignity and respect. Like many mental health and addiction organizations, we have worked daily and to serve a large number of our citizens. Several of us are involved in community education and foster prevention of mental health and addictive diseases, and most of us do additional fundraising so we can provide services that are not funded through the state. In the last few years, several of us have gathered, and that's the Georgia Association of Community Providers. I serve as co-chair, as I already said, and we see a real opportunity to improve mental health and addictive disease services in the state. This experience, and that is the expansion of community services, has convinced me that there is one critical factor in the success of any organization, and that is leadership. In examining House Bill 228, I know that we must have a knowledgeable and visionary leader to accomplish the change and improvements we are seeking. We believe that leadership for this new Department of Behavioral Health must create and maintain a knowledgeable and diverse board, people that understand the issues in mental health and addictive diseases and understand consumer and family concerns. We want to make sure that it represents the diversity of Georgia and that we pay attention to conflict of interest so that no provider receiving funds from the state serves on this board. Leadership is then extended from the board and governor in their choice of a commissioner. This position requires a national search, and I emphasize that, a national search based on the following criteria: knowledge of the recovery model, and we're giving you copies of the recovery model, for consumers of mental health and addictive disease public services so that they can lead productive lives. We also want a person that has extensive knowledge of mental health and addiction treatment services and dual diagnosis, and many years in the practical application of service delivery and policy development for mental health and addictive diseases. We're very supportive of the regional system. I think that's something we're going to have to look at as far as how many regions we have and how we gather input from families and consumers and determine the needs of regions, because they're all different. It's important that we continue with the regional system. I can't emphasize that enough, because that is our window into what community needs are. It is exciting to realize that we'll have a new department and new letterhead, and we show the commitment to mental health and excuse me, I'm having trouble there, and addictive disease after living in the shadow of DHR for all of these years. Finally, people striving for and living in recovery will get attention and the priority they deserve. However, this means nothing if it is just a nice logo and a mission statement on paper without the resources to expand access to quality community services. The vision and goal of this new department must be on building community resources to offer individuals a continuum of care that includes hospital only when necessary. This can't happen when providers are closing programs and offices because funding is shrinking year after year. As a CEO, I encourage you to draft a new agency able to attract and retain talented leadership with a bold vision to improve mental health and addictive disease services without being hampered by the old ways of doing business. Let's create a Department of Behavioral Health that we can say we did it right the first time. Thank you very much for the opportunity to speak.
Hold on, we have a question. Representative Gardner.
Thank you very much. Every day when I drive down to the Capitol, I pass quite a number of homeless people, and I suspect some of them might be in your dually diagnosed program. Where do they live? I mean, what provisions?
Well, what you're seeing is the Task Force for Homeless Peachtree Pine Shelter.
No, yes. I do see, those folks
that.
and others, but my question really has to do with the housing, that the supportive services that you would provide.
Okay.
Where is the housing come from? I mean, where are these people, if they wanted to get off the street, where could they go? And do you see anything in this bill that addresses what seems to be a serious need?
In terms of housing?
Yes, supportive housing.
And basically we're doing long-term residential care, and we just started doing supportive housing this last year. So my
question is, do you think there should be something in this bill that addresses the housing?
Yes. I'm sorry, Pat, I didn't understand. So.
Thank you. Elizabeth Appleby. Paul Bolster.
Unlike Representative Mueller, I've also had 10 years, 12 years or so as a member of the legislature, but probably not quite so high profile as she's been, and that was a long time ago. I come today to talk about a particular issue which really Pat's question introduced. I believe that I have a simple idea. It's very simple. It doesn't cost you any money, but it could save millions in terms of public expenditures on social services over the next 5 to 10 years. The simple thing is that people that receive services also need housing. And the concept that has swept the country as a way to do that is the concept of supportive housing. It's fairly simple. It's hard to produce. So you have to have governmental structures that are oriented and creating minor policies that then help with the production system. I have attached a little one-pager here on the back with lots of numbers in it. Try to simply summarize that. Different state reports show that there's a need for 18,000 units of supportive housing. Now, you say that's a lot, and it looks like it'll cost a lot of money. Currently, the state is spending, according to this, these numbers were put together by DCA. Currently, the state is spending $863 million on the people that would be in this housing. If you had the supportive housing, what you would have is you'd have a savings of $238 million, or 28% of what you're currently spending. There's a lot of numbers here and a lot of programs that you have to investigate. What this would require is an intentional effort to shift some of your $200 million that the state gets for affordable housing over and prioritize that for supportive housing. Now, I don't expect you to grapple with all the policies that are potentially implied here on the last page. But when you do create the Department of Behavioral Health, what is desperately needed is within that department, and I don't want to tell you what's in the department or anything, but within that department is a small office of housing. From the social service side, what is most needed is the coordination function between all the alphabet soup programs and funding that come from federal, state, local kind of effort. There needs to be expertise developed on housing questions within the Department of Behavioral Health. And I've outlined a little amendment to you on the second page of this testimony, which lays out some simple strategies. This was taken from an understanding of how Tennessee does this. They have an office like this in their DHR division, and they've been responsible for creating 7,000 units of supportive housing over the last 4 years. It's the Housing Initiative in Tennessee. Long reports have been done on that, and DHR itself has studied that over the last couple of years. What I'm asking for here is a way to integrate the housing policies which happen at DCA, that's tax credits and home funds and bond financing and a whole variety of tools that they have, with the service component that is in DHR. Unless you put somebody intentionally, every day they wake up and they go over there and think about how they're coordinating all these multiplicities of funding levels, you won't be able to produce the supportive housing that we need. And bottom line, this is a tremendous opportunity when you're reorganizing to create an emphasis on this new and modern and basic approach where you're blending services together with housing. And just an office there doesn't cost anything. There's actually 1 or 2 people at DHR that already do this. You need to make sure they get over there and they get thoroughly highlighted in what you pass here in House Bill 228. I said a lot, and if there are any questions, I'd be glad to respond, but I thank you for the work that you're doing.
Thank you. Melanie Fisher.
She was unable to come. She's a social worker.
Okay. Chair apologizes that we went from a list that was somebody had put on a computer to a non-computer list, and somebody's got about the same kind of handwriting as I've got, which is not very good. It seems like to me that the organization is RAKSHA. Sorry.
We figured it was me. Y'all were hesitating a bit on the name. My name is Aparna Bhattacharya. I'm the Yeah, it took me a while to learn it too, so. Aparna Bhattacharya. Okay.
This country boy had no shot at that.
Actually, I'm from Georgia. Born and raised. I'm the executive director of Raksha, which is a community-based organization working to address family violence in the South Asian community. And the South Asian community consists of individuals from Bangladesh, Bhutan, India, Pakistan, Nepal, and Sri Lanka. And we've been around since 1995, and in all of our years of existence, we've always worked with the Commission on Family Violence. So what I'm here to do, kind of talk about, which I'm sure you've heard, is how important it is for y'all not to strike the Georgia Commission on Family Violence from this bill. I mean, not to dissolve the Commission on Family Violence. So there's a few points I want to talk to you about, and some of you may have already heard from me. That not all the domestic violence programs get DHR funding, and not all of us are shelters. Some of us are community-based. And the Georgia Commission on Family Violence plays a great role of really being into the community, being in the community, present in the community, and providing resources for those organizations that do not get DHR funding. The other thing is, I'm here today because I can't be here every day. And the commission, because we're doing work with our community. We've got many victims that we serve, and that takes a lot of time. And so I rely on the Commission on Family Violence to be here to represent the immigrants that I work with, who have a right to safety and access to the services that our state provides. And I want to give you an example. One example is a woman that I worked with many years ago, who was married to a citizen, and she was an immigrant woman, and she was being battered by her citizen husband. The husband happened to know the local law enforcement, so whenever she made police calls, it was never documented. She went to go get a protective order, and when she went to go get a protective order, she was charged a fee to get that protective order. Now, we all know that in the state of Georgia, we don't have to pay a fee to get a protective order. Now, I had to go to the commission and get their help to say, what do I do? This woman's being charged for a protective order. Now, I don't know if she was being charged because she was an immigrant or because this county didn't know any better. And it was because of the commission that I was able to help this woman get her money back and let those courts know that they weren't supposed to be charging victims for temporary protective orders. Again, at the legislature, the commission represents us when there are laws that are passed that would prevent victims of domestic violence who don't speak a lot of English to having interpreters in protective order hearings, or to keep them from getting information about safety and access in their own language. And that's where I really rely on them to be here daily because, again, I can't be here. Additionally, you've heard from my esteemed colleagues that they have a multidisciplinary conference. And it's at this conference that you get advocates, so I get to hang out with judges and meet solicitors and tell them what's on my mind, and we get to kind of come up with some great solutions. And one amazing thing that happened at one of these conferences is I had this list of information on what immigrant survivors needed when they were getting protective orders. Because there's a lot of things, and I don't know how much you know about immigration and domestic violence, but immigration is used as a tool of domestic violence. When women are threatened to have their immigration status taken away, they had their documents kept from them, and because their batters may not have filled out the immigration paperwork, they may be scared that they may not have access to the resources that are available in our community when in reality they do. As a result of this conference, I was able to give some of this information to a judge who then implemented a Appendix B bond order, which is specific to immigrant women, so they can get their documents and have their rights looked after when they're getting a bond order. I think one of the last things I want to say, because I know my esteemed colleagues have inundated you with so many comments about the commission, is that they're a voice for battered immigrant and refugee women and children. When planning their conferences, when looking at their policy work, when planning their Stop Violence Against Women Day, they include immigrant voices at the table. We're in the planning committees, they have them speaking at the conferences, and have us represented. So they're a great ally and a great resource for those of us who are short-staffed and really doing a lot of work in our communities. So again, just to kind of make it short, I just want to let you know to amend House Bill 228 to ensure that the Georgia Commission on Family Violence will continue to be an independent voice and ally to ensure that all survivors of family violence have access to safety and justice. Thank you so much.
Thank you. Eddie Anderson.
I'm a country boy too, and I come from a long way from here. How y'all doing?
Good.
My name's Eddie Anderson, And I'm from all around Statesboro, Meta, and Badea, every other county that run crazy people out of down there. That's how they do it. First thing I'd like to say to y'all is CIT got a grant, and it's the most wonderful program I've ever seen. If you don't know about it, learn about it and fund it with some of your money, because it'll save you money in the long run and save people getting hurt, including officers and anybody gets involved in it. I've been in your hospitals, your Georgia regionals, Augusta, and Savannah like 15 times a piece, because I'm one of them bipolar people. And I've seen the abuse. And I'd like to know why people from the government can't just walk in there and check it out without warning them. Or had to have some feds to come in there. And the same thing, why does y'all have to spend money on these organizations to look after mental health people? Why do y'all have this audit people come in there when somebody from the state can come in there and you save all that money? Well, I believe that behavioral health is a poor name because it gives mental health a stigma. Because first thing they're going to say, well, they don't behave. And that's a stigma right there. And we're trying to fight stigma on the one hand and get it on the other. But I know people developmentally disabled and mentally disabled that I've been in the hospital with before. I truly believe on the alcohol situation, the Anheuser-Busch and some of them breweries would have to pay up some money, and I believe that the tax is too low on alcohol to start with, and the governor and everybody look at raising taxes right there on the alcohol to take care of some of that problem, to take the burden off for the citizens that are not drinking. But that's just me. Them Georgia regionals, like down there in Savannah, for instance, Al St. Lawrence, for instance, the sheriff of our distinguished lady that comes from up there, if you close that Georgia regional and say they got to take somebody to Columbus, Georgia, that means the officer got to travel 4 hours back and forth. And some of our little small country communities leave with one officer on duty. Homer Bell tried to explain this to Miss B.J. Walker down there at a forum, and Miss B.J. Walker interrupted him, and he's been sheriff 40-something years. The biggest problem with the commission is the leadership at the top. We always get good answers from Gwen Skinner. There's your leader right there. But no, we got a Chicago person. I disagree with searching the world when you got a perfect person right here in Gwen Skinner and leading this commission you're setting up. She's brilliant. She don't need to retire. We need her a little bit longer. I wouldn't mind if she worked a little bit more with mental health. She might volunteer and help do something. There's colleges like the Medical College of Georgia who helps out at Augusta at that regional hospital for free. Same thing with Savannah and Armstrong State. And Statesboro got good colleges and psychology department, and we did have mental health there at a place called John Play, but addicted diseases wiped it out. There's a lot of treatment for people with addicted diseases. I went to a county called Trutland, and they got some camps out everywhere that had to work and farm for about 6 months and a lot of discipline. That helps. I had a friend named Paul Anderson in Badea. He took children in trouble, 17, 18 years old, and at his place for a year, they were different people. I know I can't talk about Jesus in the government, but it does help. My friend Michael Guido and Paul Anderson, they've helped me keep from getting dead, helped me get straightened out a million times. And I believe in faith, and I believe in working together. And we haven't had that in our commission with our leader. And that's been our biggest problem, is you can't go through with nothing. And Sheriff Al St. Lawrence says, he writes in the paper, where's Sonny? Well, Sonny hired the lady from Chicago. It's in the paper she's been paying her friends. I didn't think we had the money to pay nothing, let alone extra money to some consultant, whatever that should be. If she wants a consultant, there's one right there. Guarantee you. I've said enough. Thank you.
Thank you. Marilyn Vickers. Marilyn Vickers. Pam Schubel. Heather Rolls. Okay. Stan Jones.
Well, I am Stan Jones, a lawyer with Nelson Mullins, for the 25 cents that Nora Haynes paid me. I will hold everything she's told me in confidence and not repeat the things that I recommended that she do that she didn't. I'd like to make a couple of comments for some of our clients and then make a personal statement also, if I could. First of all, the Easter Seals organizations have asked that the Babies Can't Wait program stay within the Department of Community Health or with the public health functions. Most of what they're doing now relates to providing disability services for physically disabled people, and their primary relationships are with Medicaid and how things are funded in that way. The Heather Rolls is the executive director of the Multi-Agency Alliance for Children. It's a managed mental health company for kids in the foster care system who have behavioral health issues. And they have multiple levels of care where they are paid on a capitated basis and move the kids from the most secure levels down to community placements with foster families that are returning to their homes. They've had asked me to raise an issue that relates to sort of how the regulations are performed, of their particular agencies. And one thing that's sort of been happening recently is that there are sort of multiple inspections for roughly the same types of issues, some that come from the licensing agencies and the Office of Regulatory Services, and some that come from the provider relations units within DHR. There's essentially kind of a duplication of the reporting and monitoring activities, for this set of healthcare providers. And I think the point that can be made for that as it relates to structure is having all of the regulation in one place and the monitoring activity sort of separate from the funding streams seems to be a sensible idea. So MAC, Inner Harbor, Chris Kids, the Bridge, Murphy Harp's, Mike Angstadt's programs would like to see the regulatory functions go to the Department of Community Health or wherever the ORS lands in the iterations that are being discussed. On a personal level, I did serve on Governor Perdue's Mental Health Commission, also chaired the 811 Commission in the early 90s that created the Community Service Board as separate activities, and was the staff person for the Governor Carter's Mental Health Commission that recommended the creation of the Department of Human Resources in the first instance. And my lawyer mentor actually was the staff person to the Schaefer Commission that decentralized Central State and created the regional hospital. So I feel a strong sense of mission about these things. I also, as you may know, had a child who was in the AJC Stories who escaped under the fence in the adult unit at Atlanta Regional Hospital. He was about the 50th person to escape in that 4-year period. All that accents really is that our hospitals are overcrowded, they've been understaffed and underfunded. And the Governor Barnes's revenue maximization program, the mental health activities at the community level, lost a lot of money because they did not sort of build back Medicaid for the state dollars that were removed from the mental health system. In the creation of the CMOs, cash was taken from the community service boards and delivered to DCH and put into the CMO contracts with the hope that there'd be more Medicaid services delivered through the community service boards. But that also has lost resources to our system, to the mental health system. I think the reorganization is about visibility, accent, and emphasis. As you've heard many times, there can be multiple different structures selected, and in many states all do different things. But I think we're at a point in time where we need to raise the visibility of the mental health and addictive disease services to the cabinet level and get their budgets directly to the governor and OPB. I think that's the main thing that you can say for it. There are lots of issues that need to be worked out about coordination of funding streams. We're still going to have some coming from DCH, some from DFACS, and some from the new department. That's one reason that the Commission recommended the Behavioral Health Coordinating Council that's at the end of the legislation. There are some functions and powers that might be accented there that would sort of focus on the kind of coordination problems you need. This issue I mentioned about getting the regulation in one place is still going to need to be solved in multiple agencies. And so there are things that remain like that to be worked out. But I hope you'll do the department now. We've had attention on these issues in Georgia. We've made the announcement that we're going to do something for behavioral health. And the sooner you get started, I think the better results you'll have. And we won't be squabbling about some of these things for another 18 months before we actually get started. I'd also like to say, with respect really for the chairman's views, that in 1971 and 1992 and 3 and the other commissions, we were working very hard to get mental health the attention it deserved. In 1971, the issue was trying to get mental health away from the Department of Public Health so that the sort of mental health could stand on its own and not be dominated by more of a physical health view of what Georgia needed. In 1993, the community service boards were actually made independent from the regional and county boards of health so that they could also focus on mental health. So those two examples, I think, accent the need for mental health and addictive diseases to stand on their own. I'd also just make a short comment that I think some of the purposes for the new department could be restated. They are 15 years old now. They don't do enough to emphasize the recovery model that's so dominant in mental health and addictive disease in particular. And some of the services that are described are too narrow for what people actually need. So housing, supportive employment, social services, case management. These are things that can be lost if you don't sort of fully describe what people actually need. Thank you very much.
Hold on just a minute. Representative Scott has a question.
Do I know the question?
No, actually. Yeah. But I will say this: had I known that you were the attorney she was speaking of, I would have commended her on hiring somebody that knew the subject and was willing to help resolve it.
Thank you very much. I thought CON was over, though.
No, and I say that with all sincerity. I respect your opinion on this issue as much as I have about 10 people that I have a tremendous amount of respect for on this issue, and you're one of them. I've got two questions for you. One of them is you mentioned briefly funding and regulatory. Is it your belief that, as I understood it, that they should be in the same department?
I actually think they need to be separated.
Okay.
And that's part of the proposal. I mean, I know we're still debating sort of which departments we end up with, but both, I guess, 2 years ago and in the current bill, we've talked about moving the Office of Regulatory Services in DHR to DCH. And that sort of allows the people that concentrate on licensure monitoring to be in one place and to be separated from some of the funding streams. And I think that separation has a value.
All right. I thought I understood you to say that they were in the same place, but that was.
Well, there is an Office of Regulatory Services in DHR. It licenses hospitals, nursing homes,
right.
Home health agencies, home care units, and the child caring institutions, child placement agencies. And so I think it should go as a unit to DCH.
Okay. But separate from where the funding comes from, so that
the
you don't
funding's
have to...
now really the sort of grant funding works through DFACS, mental health.
Okay. One of my concerns as we go through this reorganization is you've got the patient out there, or I guess as we call clients now. How do we ensure that when we go through this reorganization that the client has continuity of care? I mean, or do you see risk there in losing continuity of care? And if so, what advice do you have for us in making sure that doesn't happen?
I think the recommendation for the creation of the new department affords continuity of care for the adults who we're helping. Most of the services that are delivered for adults are coming now through the Division of Mental Health, Substance Abuse, and Addictive Diseases. And so you would have the hospital services, the community services, crisis stabilization sort of planned and funded through that one area. DCH does a lot of funding, and I think there are actually opportunities, I think as Josh Norris mentioned, that we're not taking advantage of to use Medicaid money to pay for more mental health services. And so there's some risk of loss of continuity if you're not doing those together. But bottom line, to me, at least the financing activities, have been located in a separate place since DMA was pulled out of DHR 15 or 20 years ago, and it makes more sense to continue it that way. The issues with kids are more difficult. Right now, the child care institutions and the psychiatric residential treatment facilities in their behavioral health services are treating the kids primarily coming out of the foster care system. You do have 2 child and adolescent units at Milledgeville and in the Atlanta Regional Hospital. Those are, I think, gratefully going to be closed by DHR. It's already started working on those. But you're still going to have a situation where some of the child care institutions are going to have some of their money coming from Medicaid, some from DFACS, and some from the new division. And so making sure that works smoothly is going to be a problem. I think it would be dishonest not to say that. There's a lot of kind of almost medical, philosophical debate about kids at younger ages, whether they really are suffering from diagnosable mental illnesses at a certain point, or what are their active behavioral issues. And we've really had those things sort of split up for a while. I guess certainly from my own background, primarily in mental health, I think that you have that at least the services delivered in the communities, are best done through the new department and its delivery systems. But I can't tell you that's not a complicated issue. It's not fair to DHR not to say that it's very complicated.
Representative Oliver.
I'm genuinely conflicted about regulatory services issues. But I think as a matter of principle, separating the funding from the licensure is the right policy decision. I'd like you to either tell me now or think about it, about what your opinion is, the recommendation that the child service-related regulatory services be moved to the Office of Child Advocate, because I'm very concerned about those institutions having a specialized focus and mission.
Well, I can tell you that the several clients I have in that area do want their regulatory activities moved with ORS. But I think it's a hard issue about what's right in that regard. There's some other complicated issues too. In the bill, the community living arrangements are landing and staying in the new Department of Human Services. They're actually used both for DD patients and for mental health patients. So
and DJJ.
Right, and DJJ. So that's also a tough one.
That was sort of the same question, but I just wondered what you thought about that recommendation, and if it's the Office of Child Health, somewhat separated, which seems important to me. What would you do about the adult services?
I think it'll fall naturally that I think the folks who are interested in child and adolescent mental health services have a little bit different notion about helping the kids get better, believing that they can return to their families. They still have families often. Mm-hmm. On the adult side, you end up with folks who actually are more isolated. So having an office or a division within the new department related to children and adolescents, I think, would be appropriate, well received. It will make a lot of sense, particularly if the units of the state hospital are closed. And you could focus on where the behavioral health services for kids really are. They tend to be in private, nonprofit agencies right now. The adult part sort of falls out sort of naturally from that conclusion that, the bulk of the people served by the CSBs and by the state facilities are adults. And the recovery model makes more sense there. As people get older, you have a better sense of what they need. The diagnoses are clearer when people reach their 20s than they are before that.
So you're saying that regulatory function would be in BH?
Oh, I didn't know you were asking me the regulatory. I think that goes with ORS too, frankly.
So you think it would be separated from any of these three departments?
Right, although I know in the governor's proposal it lands in DCH.
Thank you.
And I know that a lot of people feel like the regulation of finance are sort of naturally related.
Representative Hurd has a question.
Thank you, Mr. Chairman. Stan, I guess my question is, through this whole process of reorganizing, I was here, I first got here when House Bill 100 was first passed. That was one of the first major bills I voted for. What have we learned from House Bill 100 that's been incorporated in what we're doing now? The good things, should I say, are the things that we don't need to do. That's been 17, 16 years ago.
Right.
And as I look and listen to the speakers, mental health has definitely been something that's on the top of the list of all the other things we've talked about with this reorganization. So I guess I'm making a statement and I'm asking a question. I hope that as we go through this process, that we do look at what we learned from House Bill 100. And the things that we don't want to do and the things that we may want to do different, you know.
I think House Bill 100 was intended and did have the effect of kind of encouraging the use of more sort of private service agencies around the state, particularly in areas where the community mental health centers were less developed. So we have more providers now than we did then, and the focus on trying to provide more than one choice to most folks who suffer from the disabilities was advanced by the idea. The accent on involving consumers and their family members, you know, in some of the decision making has continued. It's in the new bill. You know, it's part of the sort of destigmatization effort that many of us have supported for a long period of time, and the sort of listening to how the consumers and their families feel about how services are delivered was accented by 811. It's still in the bill. I know Representative Gardner's been raising the questions about the regional boards. They were actually intended to be sort of localized managed care entities that would control both the inpatient hospital beds and the state facilities, you know, use the community hospitals, fund the community service boards. That was more than many parts of our system could stand. It decentralized control, so it ended up being a problem, I think, both at the division level and at the community level. You know, I was attached to that idea, so it's hard for me to say it hasn't worked. But it's an honest question about how decentralized you want decision making to be made. You know, the House Bill 100 idea was to really push it down to the regions and have a single entity that was accountable for both the inpatient and outpatient services. You know, since then, you know, the community service boards have been declared fully public agencies, which is something that's very important to them. And they've always had the bulk of the resources to use in the community level, and in a way, they sort of get funded directly by the division now instead of having this intermediate body. So I think it just proved to be too complicated for what could happen with volunteer board members. But I think the ideas are still pretty good.
I see no more questions. Stan.
I will say that mental health has been a public responsibility since the 1800s, a state responsibility. You know, Central State was a state agency, our asylum. In '64, Medicare and Medicaid were created. The governors and President Johnson made a deal that mental health would stay a state responsibility, so that's why Medicare and Medicaid primarily don't fund the inpatient care. We do have more people in our jails who have mental illness than we have in our hospitals, more people in our prison than we have in our hospitals. Those are primarily state money. So that's, de facto and sort of historically, that's where the responsibility has laid for the safety net. We're entering an era where we're going to have more federal resources available to finance our community programs in particular, and maybe eventually our hospital ones. So there's some bills in Congress now to let the facilities bill Medicaid, at least for emergency services and perhaps for fully inpatient ones too. Those are nice opportunities that help our fiscal situation and get more resources to mental health and addictive diseases. The main problem has been we haven't had enough resources.
Representative Scott has a question.
And can I ask you one quick question? And I should know this answer, but I don't. The pharmaceutical formularies, have we gotten to a uniform formulary for the counties and the state so that when an inmate is transferred from a county facility to a state facility, they don't have to go through?
We do not have there. We're not there yet. We did talk about it a lot in the Mental Health Commission. It's one of the recommendations that's in there. It's very important. Some of the better psychotropic drugs are about to come off patent and become generics and less expensive. I mean, that's another opportunity where you could actually save some money and deliver to people the medicines that have fewer side effects. But it's not uniform yet. I mean, there's been a lot of work on it, just haven't gotten there.
Thank you.
Thank you, Sam.
Sure.
Dave Blanchard.
Good afternoon. My name is Dave Blanchard. I represent the Unlock the Waiting List campaign. Thank you for the opportunity to address you today. We share the concerns and suggestions presented by the Governor's Council on Developmental Disabilities, the ARC of Georgia, and the Georgia Advocacy Office. I'll focus my comments on three requests. We ask that this bill include stated commitment to a division on developmental disability, that it includes language to ensure clear lines of accountability for funds appropriated for disability programs, and that this process allows for a full review of the audit report submitted by the consulting firm to all stakeholders. Services to people with developmental disabilities reach excellence when strong leadership is accompanied by clear authority and accountability. Strong leaders perform best when lines of authority are clear, and each professional position in developmental disability system should clearly be accountable to a person in a supervisory role, and all positions should be ultimately accountable to the director of a division of developmental disability. Developmental disability leaders cannot perform effectively when they have no authority over important components of the state developmental disability system, such as staff in the regional office, hospital administrators, and their staff. Developmental disability service providers cannot be held accountable to people and families they serve or the taxpayers who support them when lines of authority are unclear or non-existent. And this line of authority requires budget transparency as well. There is no satisfactory accountability for DD funds when budgets are intermingled or when allocations are not clearly documented or audited. This bill should not only include language that defines a division of DD, but should do so in a way that offers safeguards to these lines of authority and accountability. We learned on Monday that an accounting firm will present a report to the committee roughly around March 16th, and we all know their given task is a difficult one. We have learned how complicated these funding systems are, these streams of funding, and from past audits. For example, a recent audit conducted by the Department of Audits and Accounts presented to Representatives Harbin and Butler in October of last year found that examining long-term data prior to 2006 is questionable, and since 2006, DHR's more recent accounting data is even in doubt. Therefore, we trust that ample time will be given to examine and respond to this report by yourself and all stakeholders. Any organizational structure must anticipate a long-term plan for supports that incorporate expanded home and community-based services for adults and children rather than hospitals, nursing homes, or facility-based care. It should support long-term care that is flexibly funded to follow a person to any preferred setting throughout the state. For people with disabilities, our state has rightly committed to rebalancing our resources from our state institutions to the community. It must be recognized that currently there are DD dollars flowing into facilities for staff and supports that need to be redirected to the community. And there needs to be a careful and transparent examination of these current funding streams before moving forward. so that our goal of rebalancing our system and leveraging all the dollars possible in the best way for persons with disabilities. Thank you for your time.
Thank you. The chair would like to thank everybody who's come a long distance and a short distance, both. Whoops. Yes, ma'am. You had signed up. You weren't here, Ms. Africa.
Forcefully. Mr. Chairman, members of the committee, my name is Elizabeth Apley, and I appreciate the opportunity to testify on behalf of the Georgia School Age Care Association. I'm speaking also for Voices for Georgia's Children and the Georgia Budget and Policy Institute. Voices had submitted a position paper previously released on this issue, encouraging, as a part of this reorganization of the Department of Human Resources, the possibility of transferring the child care subsidies program from the Department of Human Resources DFACS to DECAL, the Department of Early Care and Learning. And we see that as a critical opportunity to link the largest child care subsidy program in the state of Georgia with DECAL that is committed to the issue of child care quality. And we see this as fulfilling the fundamental purposes of the reorganization, and that is both focus and addressing the best interest of clients. The relocation of the CAPS program would provide for administration and services that will be streamlined and eliminate duplication. We would have a more cost-efficient system because if we monitored all of the providers of child care services in the state in a single location instead of dividing it between DHR and DECAL, we would gain efficiencies. We would also benefit by allowing for the processing of payments within the DECAL system because they're already doing that for pre-K and other providers. We also would allow the remaining of the eligibility determination within DHR, but allow for the direct relationship with the providers, the child care providers, to move to DECAL. It's going to allow for a better coordination of child care services because all child care services are regulated now by DECAL. So DECAL has those relationships with the child care providers, with Head Start, with Early Head Start, with pre-K, and the child care food program. Finally, as I mentioned earlier, the opportunity to relocate in DECAL allows this subsidy to be a point of leverage in improving quality for child care providers in Georgia. The standards relating to quality, the licensure, the minimum training, all of the regulation comes out of DECAL, and those could be adopted and leveraged with this program. More than a dozen states have done this. They've combined early childhood and education with licensing and quality initiatives, including South Carolina, Arkansas, Idaho, Indiana, and Maryland. We urge you to consider this initiative. It's especially important as this CAPS program plays such an important part in keeping people connected to work during this recession. And I would just add as a footnote on behalf of the Women's Policy Group that we encourage the committee to continue to support the Georgia Commission on Family Violence on behalf of the women of the state.
Thank you.
Thank you.
That is our last scheduled speaker. Again, thank everybody for coming today and letting this committee know how you feel. It's important for us to know that because the matter before us is very important and it's complex. And we're going to do our best as a committee to get it right in a timely fashion. Also, the chair would like to thank the members of this committee. Pretty much all of the members are here and have been here the entire time this afternoon, and I thank you for your time as well. We stand adjourned.